70% effective doesn't sound quite as positive as the other vaccines. And the other thing is, when do we get it?
Yes, so this is very positive news. The 70% effectiveness overall. In some formulations of doses, it has evidence of up to 90% effectiveness, and crucially, no hospitalizations. So even those who get symptoms in this trial didn't end up needing to go into hospital. So that is very positive news. We're not quite there yet. We need to ensure that the regulator, the independent regulator, looks at the data, both the effectiveness and, of course, the safety data. And then, of course, we need to get it rolled out. And to come to the second part of your question, we've got 100 million doses of this on order. And if all goes well, and if the regulator signs it off, then we should start the vaccination program next month.
Matt Hancock, how do we make sure that the vaccination program goes smoothly? We've already seen that by prioritising NHS services for those who are suffering from COVID, so many other people have not been seen in the way, shape or form or time that they deserve to. GPs are very concerned about the pressure that rolling out a vaccination programme will put on surgeries, and anybody wanting to see a GP will be concerned that they may miss out because the vaccination programme rightly will be prioritised. What kind of guarantees can you give people?
Well, we're not just rolling this out through GPs. They, of course, will be important in the same way that each year they roll out the flu vaccine, and this year the biggest flu vaccination programme in history. And the timing of this means that at the point at which the flu vaccine programme ends, that's more or less when the COVID vaccination programme will start, subject to, of course, the final sign-offs of these vaccines. So GPs already do vaccinate in large scale. It's not just the GPs themselves, of course, who can vaccinate, the practice nurses, pharmacists and others. But in addition to that, we're going to have large-scale vaccination sites where people can go to that are put up and built especially for this vaccination program, that'll be run by hospitals rather than by GPs, to make sure that we can use all of the assets of the NHS to vaccinate as quickly as possible. The challenge I've given the NHS is to be able to vaccinate as quickly as the pharmaceutical companies can actually manufacture the vaccine.
Okay, if it goes well, the vaccination program, then we could be in a brilliant position, couldn't we, in a few months? Yeah, I think we all share the fingers crossed we do. This is good news, and it's obviously moved at a breathtaking pace. If we do get the vaccination program off and running and it's smooth and we all get vaccinated and we get back to relative normality, say, in a few months' time, it does beg the question, why are we putting so much emphasis right now, it seems to me, the government, on trying to give everybody a big, jolly 5-day Christmas knees up, when that could put us back in terms of infection rates and, sadly, deaths?
Well, I don't think it will do that. We haven't finally agreed a set of rules around Christmas, but I essentially agree that it needs to be careful, it needs to be balanced. We're trying to put in place an agreement across the whole of the UK, because so many people live in different parts of the UK and typically travel at Christmas. But there's this balance, Piers, between people wanting to see their families at Christmas, and by God, I know that, and at the same time, absolutely, as you say, keeping people safe. Because whilst the vaccine is now, very much in prospect, it will take a few months to roll it out. The bulk of the rollout will be in the new year, even if we get the approvals rapidly from the regulator. And so we've got to keep the current measures. We've got to all stick by the rules and keep doing the things we know we need to do, the social distancing, the basics of hands, face and space. We've got to keep doing that to keep people safe in the meantime.
The message you're sending, though, I think you probably made the same point, the mixed messaging of, on the one hand, all the papers, you know, Christmas is coming, it's all going to get relaxed again, you're all going to be able to meet up in 4 different households at Christmas. If you've got a big household, normally I'd be with maybe 30 members of my family. Is the government really going to suggest that we should all get together, 30 people from 4 different households all over the country?
If you say we've got to keep doing the same things that we're doing that are working, why would you suddenly take a break at Christmas?
There just seems to be, once again, a contradiction in the messaging from the government, because we know the virus is no less deadly, we know how it infects people, we know that inside in particular it's at its most virulent. Why encourage people? Why not just say, you know what, we've got to suck it up for a few months? Sorry, wouldn't that be easier?
Well, because Christmas is undoubtedly the most important holiday of the year. And it's a matter of balance. And so, of course, I understand those concerns, but I also understand that this has been really hard for people. But the good news is that we've got now the serious prospect of the vaccine on the horizon, and crucially, we've seen the very positive impact of a large-scale rollout of testing in some places. In Liverpool, it's amazing. Have you seen the case numbers in Liverpool have fallen by over 2/3 in the last few weeks?
Yeah, no, it's all,
since we set out the mass testing.
But the thing is, you're right, there is a balance to be struck. But why strike it right now when the vaccine is literally within weeks? There are lots of families who couldn't bear the thought of celebrating with elderly or vulnerable relatives, for instance, and then 2 weeks later, hearing that they've got symptoms. I mean, why is that possibly worth the risk?
Well, of course, personal responsibility is an important part of this, but it's the balance that you talk about. That's what those discussions are trying to seek, and to get an agreement between the different devolved administrations as well.
Let me ask you about pay. We're going to hear this week from Rishi Sunak, apparently, about public sector pay, and it looks like there's a bandwagon now for maybe even a 3-year freeze on most public sector pay. And many people may understand that. They might understand we borrowed 350 billion, we can't just keep doshing out cash left, right and centre. However, what they won't understand is if MPs, including yourself, take a pay rise, and it's believed the recommendation is you're all going to get £3,360 as a recommendation from the independent body. I know you haven't voted for this. I know that it's been decided and that's what you may get. But surely the right thing to do, Health Secretary, given what happened in, say, New Zealand, which has had a far better record in the pandemic, where the Prime Minister, Jacinda Ardern, and her entire cabinet took a 20% pay cut, would it not be the right thing to do for every MP in this country, given, frankly, our woeful handling of the pandemic, that none of you agreed to take a pay rise?
Well, as you say, these things are set independently, and I have never voted on the pay of MPs. Just to clarify one of the things that you said, that decision on MPs' pay, as far as I understand it, it has not been, the final decision has not been taken.
But if you are offered a pay rise, if you are offered a pay rise, can you in all good conscience take it? I mean, my point being, none of you have to accept it. You could all just say, as a collective body, we know how tough it is out there.
Yeah.
We know nearly 1 million people have lost their jobs. We know we may have to freeze public sector pay for almost everybody for years. So actually, we're going to lead from the front. I would love to hear you right now say, I'm not going to take it.
Well, that's what all ministers did in the pay freeze that there was after the global financial crash, and
that's
me included.
Why I'm asking.
Yeah. So well, let's see what the final
why do you have to wait and see? Why can't you just say now you won't take a pay rise?
Well,
just say it.
I think I know. I'll promise to and commit to come back on this programme.
No,
immediately
Health
after
Secretary.
that
Decision comes through, and then I'll let you know. This is not a difficult question.
No, it's not.
I don't care if they give you £1 extra. You know as well as I do that no member of this government in particular, in a year of a global pandemic when we have the worst death toll in Europe and the worst economic meltdown in Europe, none of you should be taking a penny in a pay rise. So I simply ask you again, given as you rightly said, after the financial crash, nobody did, Are you prepared to lead right now on Good Morning Britain and put your hand up and say, I will not take a penny? Matt Hancock, right now.
Well, I will answer this question when
yes or no, Mr.
the
Hancock?
pay policy's been... Well, I'm telling you my answer. I will answer this question when, firstly, the pay policy has been set out by the Chancellor, because there's lots of speculation in the newspapers.
It doesn't matter what the policy is, does it? I'm just asking you
but it
to
does,
say...
actually.
Well, no, it doesn't. Because just say you're not going to take a penny.
What the policy is, because...
No, just say you are not personally going to take a
policy
penny. Just say, I, Matt Hancock, right now, tell Good Morning Britain viewers that in all good conscience, it would be wrong of me to take a penny in a pay rise this year. And I am going to put my hand up and lead.
It's very tempting. It's very tempting, Piers. However,
tempting?
I am I'm a stickler for
taking pay rises?
prejudging things. Right? No, on the contrary.
This is not difficult, Matt Hancock. Come on. This is not... I'm giving you an open goal.
Why don't you let me answer the question?
I've given you an open goal. Hit the damn football. Just say, I'm not going to take a pay rise.
Or say, I think I've worked so hard during this pandemic, I deserve every penny, to be honest.
It's one or the other. Either you think you deserve one, or you don't. But just to remind you, in New Zealand, the Prime Minister, and New Zealand's had one of the best records in the global pandemic, but they took a 20% cut. You said to footballers, do your bit. What about you doing your bit?
I know that. Yeah, I'm quite prepared to do my bit. And what I'm going to tell you, Piers, is the answer to your question. But I can't because you keep interrupting me. But
well, answer it then.
The Chancellor is going to set out the pay policy on Wednesday. The independent body on MPs' pay will then, no doubt, set out its final policy at some point. I'm sure that it will take into account all these things. The reason I'm not answering the question, tempting as it is because I think these things should be done the proper way, and I have never set my pay even to say that it should be frozen.
I'm really sorry.
I don't think it's a principle. You can't knock me off the perch.
Nobody cares about knocking you off any... Hello? No one cares about knocking you off any perch. You're not a parrot. You're the health secretary in the year of a catastrophic handling of a pandemic. I simply ask you one more time, because a lot of our viewers have lost their jobs. A lot of them are worried about feeding their children.
3 million people
being able to buy their kid a Christmas present. I simply ask you again, one last time, you have it in your power right now to say, regardless of what the independent body says, I, Matt Hancock, do not want a penny extra. You could say it. You have that power.
The clue is in the title. It's an independent body.
You don't have to take
I'm not
it,
going
do
to
you?
prejudge the answer to it.
You don't have to take it.
No, and in the past, I haven't taken it when there's been a pay freeze. So there you are.
Put yourself out of this misery. Just say you're not going to take it.
The other thing I'd pick up on, Piers, is that you keep saying about the handling of the pandemic. I think you'll find that when we have now built the biggest testing regime, and I'm really, really pleased that we've been able to get this early progress on these vaccines. Of course, there have been challenges all the way through this, but that's really serious progress.
Do you think